So our final guest today is Dr. Dayna Lee-Baggley. So I'll just ask that the noise level come down just a little bit more. All right, so Dr. Lee-Baggley is an assistant professor in the Department of Family Medicine and is cross-appointed in the Departments of Surgery and Psychology at Dalhousie University, and is an adjunct professor in the Department of Industrial and Organizational Psychology at St. Mary's University. She works as a clinical health psychologist at the Nova Scotia Health Authority, and she's here to talk to us about the emotional coping and what that's like when living with a chronic health condition. So I welcome you all to welcome Dr. Dayna Lee-Baggley to present today.
Hello, can everybody hear me okay? Great, well, thank you so much for having me. I know we're at the end of probably a long day, so I'll try to make it as entertaining as possible when, because clearly that's exactly what you expect when you're thinking about a presentation about the emotional impact of chronic disease. Okay, so as I was introduced, I'm a clinical health psychologist, so I work at the Nova Scotia Health Authority, and I also have academic appointments at Dalhousie University and St. Mary's University. So I'm a health psychologist, and what that means is that people who are referred to me are referred because they have some kind of health condition. So they're not referred because they have a mental health condition, they're referred due to a health condition. And it's really about understanding the interplay between physical and emotional illness and health. And so we work a lot around promotion and maintenance of health behaviors. So, for example, you probably got a lot of recommendations today about things that you should be doing to improve your arthritis, right? So things about diet or exercise or medication that should help you. And those are all what we would refer to as health behaviors. They're behaviors you could do that would improve your health. Okay, so one of the issues about chronic disease is that there is an emotional impact of living with a chronic disease, as I'm sure most of you already know. And we can think about it as sort of like a continuum of distress. And at a certain point of distress, you're going to meet diagnostic criteria for a mental health disorder. And so these would be things like a major depressive disorder and anxiety disorder. So that's at the upper end of distress is a mental health disorder. And you do have a higher risk of having a mental health disorder if you're living with a chronic disease. But in addition, there is a range before you get to the mental health disorder, which is about distress. So this includes symptoms of a mental health disorder. So it includes symptoms like depression, hopelessness, anxiety, worry, but it doesn't yet meet the criteria of a major mental health disorder. And people living with chronic disease tend to have this type of distress more often. And this is distress about the chronic disease, meaning that you're feeling depressed because of the impact it has on your life, or you're feeling hopeless about whether you'll be able to return to work given your health condition. And so the distress is really about the chronic condition and the impact that that has on your life. And so we refer to this as chronic disease distress. And it's a different thing than a major mental health disorder. It's really about the impact that that chronic disease is having on your life and the normal emotional response to that, which is to feel anxious about how it's impacting your life, to feel worried about how it's going to change your future or limit your activities in the present. And so some of the ways of understanding that is that it's distress about the chronic disease. So you can see some of the items here. This is a questionnaire that we developed that looks at different items to capture chronic disease distress. So things like feeling like my chronic condition is taking too much of my mental or physical energy each day, right? Or feeling angry, scared, or depressed when I think about living with my chronic condition. So these are very normal reactions to having a chronic condition and are separate from having a mental health disorder. And we can understand that it has different sort of facets of it. So there's an emotional burden of disease, so the emotional impact it has on you. There's also regimen distress, so all the extra things you have to do to try to manage your chronic disease. Sometimes people experience patient-provider distress. This could be because you don't have a family doctor in Nova Scotia, and so you don't even have the ability to have an interaction with a healthcare provider. But it may also be that when you do have interactions with your healthcare provider, they're not quite meeting your needs or not quite understanding the issues that you're bringing to them and not addressing the things that you want addressed. And then sometimes there's social support distress also, which is that people in our lives sometimes don't understand the limitations we might have or the things we might need to do to stay healthy. And so they, plan things that are, they plan like a full day hike, and that's not something you're going to be able to do. And so you either have to not go at all or try to go and see if you can make it. And so sometimes we can also have that distress within our social network about whether they really understand what we're going through. Okay, so the thing about human beings is that we are super awesome at problem solving. We have evolved over time to have a problem-solving mind. And this problem-solving mind is really a fantastic thing for human beings. It's why we're all sitting here, not out in the cold. We're sitting here with lights and water and heat and food, right? And this is because our problem-solving mind is awesome at fixing things in the external environment, so controlling the external environment. The problem that we run into is that this problem-solving mind then also tries to fix stuff about us, and it tries to fix any problem that exists. And so if you're living with a chronic disease, your problem-solving mind, as normal minds do, will also try to fix your chronic disease. It'll try to find ways to make it go away. And this is a normal response of the human mind. But the problem is sometimes it can give us suggestions to try to fix our chronic disease that end up making things worse instead of better. Can everybody hear me okay? Because I can hear a big echo, but it's okay for you guys? Okay. Okay, so for example, sometimes we do things to try to manage our chronic disease. And they sometimes have a short-term benefit, but sometimes a long-term cost. So for example, if you're experiencing chronic pain, often things people will do is like to try to lay down or to rest to try to decrease their pain. And typically that helps in the short term, right? In the immediate short term, it does make you feel better. But sometimes in the long term, we end up having to rest too much, or we rest so much the rest of our muscles aren't as healthy as they need to be. And so in the long term, it ends up limiting the things that we can do. We also end up doing this about our feelings, trying to manage our feelings. So if we're feeling anxious about something, sometimes we try to avoid the thing that's making us anxious. And typically in the short term, that will decrease your anxiety. But in the long term, you might have to start avoiding a lot of things to try to avoid your anxiety. And so the thing is that we actually have a lot more control over our behavior than we do these other things. Okay, so we have the most control over our behavior. We have less control over our thoughts and feelings. We have less control over other people's behaviors, and even less control over other people's thoughts and feelings. So, as an example, can everybody remember how you got here today? So maybe you walked, or you got a ride, or you drove, or took the bus. Everybody remember how you got here today? Okay, now totally forget how you got here today. Just delete that memory from your mind. Anyone able to do that? Just totally forget how you got here? Now, over time, you'll probably forget because it probably wasn't a super meaningful journey here. But we don't actually have the ability to delete certain thoughts or memories, right? We don't have that much control over our thoughts, right? Now I'd like you to imagine that you're going to make your leg go completely numb. So numb that, in fact, I could take a chainsaw and cut your leg off and you wouldn't even notice. Can everybody do that for me? No? Okay. Right, because we actually don't have that much control over our sensations, over our feelings, right? So our culture kind of implies that somehow we should have control over things, and if you just tried harder, you'd be happier, or you'd be, managing better. But actually, we don't have that much control over our thoughts and our feelings. Okay, now I'm going to invite everybody to stand up. It's a mini movement break. Okay, now sit down. Okay, now what was the easiest version out of those things? Deleting the memory of how you got here, making your leg so numb you could cut it off with a chainsaw, or standing up? Standing up, right? Standing up is the behavior. That's something that somebody else can see you do. So it wasn't about whether you enjoyed standing up. Maybe you're kind of annoyed that I asked you to stand up, right? It wasn't about whether you felt motivated to or you're like really pleased with it, right? Behavior is something that someone else can see you do. And when we focus on behavior, we have way more control over that than we do our thoughts or feelings or sensations. Okay? And the problem with chronic disease is that most of us cope in life with problem-focused coping. And that's when there's a solvable problem. It's a problem that can be fixed. And so if you work hard enough, you can make that problem go away. So things like being hungry are actually solvable problems because you can find food, you can ingest it, and then you're not hungry. Now you have to repeat it again because you get hungry again, but then you can repeat the problem-solving strategy again, and you've solved the problem. So these things are solvable problems. If you have a deadline at work, for example, that is a solvable problem. If you work harder at it, you'll get the project done, and then the stressor goes away. Okay? And so problem-focused coping is how many of us function in our day-to-day lives, of getting tasks done and checking off our to-do list and making the problem go away. And the problem, of course, with dealing with a chronic condition is that it's, by definition, not solvable. We can't make it go away. For the foreseeable future, it's going to be present. And so when we try to use problem-focused coping to fix a not solvable problem, we end up in trouble because it's inherently not fixable. The solution doesn't match the problem. So instead, we talk about emotion-focused coping, and that's dealing with the feelings that show up as a result of the stressor. So we can't get rid of the stressor, but we can deal with the feelings that show up as a result of the stressor. And so this works well for things that can't be fixed. And by definition, a chronic condition can't be fixed. Okay, so for example, one type of emotion-focused coping strategy is what I call refueling activities. So a refueling activity is something that makes you feel more energetic at the end than when you started. Okay, and this can be different for different people. For some people, it's socializing. For other people, it's reading a good book. Often you'll get recommendations, to do relaxation exercises, which are, also great. But a refueling activity is something that makes you feel more energetic at the end than when you started. And if you have a chronic condition, that condition is taking a lot from you. It takes energy, right? If you're experiencing pain, it takes a lot from you when you're living in chronic pain all the time. And so we want to have enough activities to refuel, to deal with the fact that our chronic condition is taking stuff from us. And so that's, different for different people, and you can play around and do different things to see what makes you feel more energetic when you finish than when you start. Some people will talk about, coming home from work and zoning out in front of the television, right? And I'll always say, did you actually feel more energetic at the end of zoning out than when you started? And most people are like, no, not at all, right? So that then is not a refueling activity. Right now, if I go to watch my favorite movie, or go to a movie theater and watch a good movie, I actually do feel energized after that. But it's about finding things in your life that feel energizing to you so that you can make up for the fact that your illness is taking a lot from you, and to have ways of refueling. Okay, another key emotion-focused strategy when dealing with a chronic condition is called pacing. Anybody heard of pacing? Anyone told you should be pacing? Okay, not too many people. So what typically happens, especially when people have a chronic condition or chronic pain, is that when you have a good day, you're like, oh my gosh, I'm having a good day. I better get as much done as humanly possible, because who knows when I'm gonna have another good day. So I'm gonna get everything possibly done on my list that I can. And we work really hard, we try and get through our whole to-do list, and then the next day, totally spent, right? Cannot get out of bed for 2 days because we used up all of our energy. And so this is a really normal pattern that people do, which is basically using how they feel as a marker for how much activity they should do. So it's like when you wake up and you're like, okay, is it a good day or a bad day? How am I feeling? And that then decides how much activity you're going to do. And if it's a good day, you do as much as possible. If it's a bad day, you kind of can't do very much. The problem with that is that you end up in this boom or bust cycle, where you're actually making the boom and bust bigger because you're doing too much on one day and not enough on the other day. It's a really normal thing that people do, right? Of course, like, you have stuff to get done. When you have a good day, you're like, I better get this stuff done. Okay, pacing, on the other hand, is deciding an amount of activity that you can do, even on a bad day, and sticking to the same amount of activity regardless of whether you're having a good day or a bad day. So when you wake up, it's a normal thought to be like, oh, how am I feeling today? Is it a good day? Is it a bad day? But rather than letting that decide how much activity you do, you go to this activity you've already pre-decided that you already know that you can do on a bad day, and you stick to that level of activity. And overall, you'll actually be more productive this way because you won't have as many down days, right? The lows don't get as low, and so even on a bad day, you can still get some activities done. Okay, the hardest part about pacing is holding back on a good day, right? Most people are pretty good at pushing themselves a bit on a bad day. The hardest part of pacing is holding back on a good day. So when you feel really good and you feel like you can get a ton done, you have to stop. You can't keep going. You can't get everything done on your to-do list. You have to wait until tomorrow. And that's actually the hardest part about pacing. But if you practice pacing, you end up feeling more in control of your life. Because rather than deciding or checking in on how do I feel today and how's that going to impact me, right? That's your illness kind of being in charge of you. Your illness is going to decide how much activity you can get done. It's a really normal thing to do that, right? But then we feel at the mercy of our illness. If you're pacing and you're picking the activity that you're going to do regardless of how you feel, then you're going to feel more in charge and you're going to feel like you have more control over your life. Does that kind of make sense? Okay, so you will have, get lots of recommendations today about things to do. In fact, I just gave you 2, right? Find a refueling activity, start pacing. I heard a whole bunch in the last talk, right? Garlic and spices, and it was very interesting. But chances are you're gonna feel super motivated to get some stuff done. Go home, buy a whole bunch of garlic, right? Buy a whole bunch of spices, and for 3 or 4 days, totally put them in everything you eat. And then after a week, you're like, man, this is hard work, right? And then you kind of just go back to what you're normally doing. And this would be a really normal thing, right? Is that we try to do too much all at once, and then we end up kind of giving up because it's too much work to sustain in the long term, and we kind of go back to whatever habits we had. And so basically, whatever recommendation you get, whether it's about medication or exercise or diet or even psychological coping, there is going to be stuff that gets in your way, right? So this is the stress management clinic, and it's closed due to burnout, which is that even when we know what we should be doing, we sometimes don't do it, right? So I'm going to talk a little bit now about how do you do the stuff that you already know you should be doing, but you're not doing. Okay, so what I'd invite you to imagine is to imagine that you are a bus driver, okay? And on your bus are all kinds of passengers. And some of them are friendly and nice, but some of them are kind of bossy and annoying, and they like to tell you what to do. And I'd like you to imagine that these passengers on your bus are your thoughts and feelings and sensations. So there's an angry passenger who's like, I can't believe that guy cut you off. You should go tell him off, right? There's an anxious passenger who's like, oh no, don't go there. That could be really bad, right? So can everyone kind of imagine that these passengers on your bus are thoughts and feelings and sensations? Everyone okay with that? Okay, now sometimes these passengers take us off our route, right? So I'll come home from work and I'll be like, oh, I should go to the gym. And then I have a little passenger that says, I don't have time for that. I'm like, oh yeah, you're right. I have to do that talk. I got to send those emails. I got to do this. I'm like, no, I should go to the gym. It's too cold. Just do it tomorrow, right? Yeah, it is really cold. Maybe it'll warm up tomorrow. I don't, I'm like, no, I should go to the gym. You're so tired. Just, wait another day. Yeah, I am too tired. I'm not going to go, right? So sometimes these thoughts and feelings, right, get in our way and take us places we didn't mean to go. And even though I meant to go to the gym, I'm at home sitting on the couch watching TV, right? So given that sometimes these passengers kind of get in our way, what are some of the ways that we could deal with these passengers so that they weren't getting in our way as much? Any thoughts or ideas of how we could deal with the passengers? Kick them off the bus, of course. Wouldn't that be like the easiest solution? I mean, if I never had the thought, I don't have time for that, wouldn't I do a lot more healthy things? If I never was like too tired, wouldn't I like go be a lot healthier? Of course, absolutely. Okay, so has anyone found a way to permanently not be sad, not be anxious, or maybe not think at all? Anyone? No, right, no, of course not, right? So even though that makes the most amount of sense, right, is to kick the passengers off the bus, we can't because they're part of the human condition, right? I mean, do you know anyone who's never experienced sadness or never experienced anger? I mean, if you do, you could like send them to me and I could do a case study on them because it's actually not normal. Right? Now, there's a difference between expressing anger and feeling it, right? But normal humans, you know who doesn't feel anxious? Psychopaths. Psychopaths don't feel anxious, but I don't totally recommend being one of those either. All right? Okay, so the problem being is that this is what we do. It's really normal. We're like, once I don't feel tired, then I'll go to the gym. Once I have more time, then I'll pack a healthy lunch. Once I don't feel guilty, then I'll make some time for myself. And we're waiting for those passengers to not be there before we act. And that's the same idea as trying to kick them off the bus to try to stick to our route. Which, of course, right now, I mean, you could take some detours. Like, frankly, when I go to the land of, like, wine and chocolate, I don't hear them yelling at me quite as much, right? But, you know, I wake up the next morning and bam, there they are again, right? So there's lots of temporary things we do to not hear the passengers, but kicking them off permanently is a really hard thing to do because they're part of being a human being. Okay, so if we can't kick them off the bus, any other thoughts about how we could deal with them? They're kind of taking us off our route. Distraction, yep. And so, meaning us distraction or the passenger's distraction? Us? Yeah, so sometimes, you know, this might be a bit what you mean, but correct me if not, it's sort of like, I'm just not gonna listen to them. I'm just gonna pretend they're not there, right? I'm just gonna like not hear them and I'm just gonna pretend I'm not tired. I'm gonna pretend I don't hear, you know, I don't have time for that, which of course is a great, also logical thing to do, right? So if you imagine a passenger on the bus and he's like, hey, bus driver, I gotta get off the bus. And the bus driver completely ignores him, you know, doesn't pay any attention to him, doesn't acknowledge him in any way. What does the passenger do? He gets louder, right? He's like, I gotta get off the bus. He like starts shouting. Maybe he like runs up to the front of the bus. He's like, I gotta get off the bus, right? And so when we try to not think about them or not feel that way, sometimes it actually makes it worse, right? It actually makes whatever it is we're trying to not think about worse. So even though that totally makes sense, sometimes it actually backfires to try to not feel sad or try to not be angry. Okay, so sometimes we end up in debates with the passengers, right? Where I'm like, there's like a piece of cake in the fridge, and I'm like, oh, I want to eat that cake. And, you know, and I'm like, no, I'm trying to, no sugar. Remember the last talk, I'm not supposed to have sugar, right? That's a lot of processed sugar. And then my passenger's like, well, just this one. I mean, you can eat healthy tomorrow, right? I'm like, well, no, I'm trying to be healthy. Yeah, but once it's gone, then you won't have to deal with it, right? Just like then you won't have to think about it. So let's just get it over with, right? You're gonna do it anyway, right? So I don't know. Anyone have that kind of experience where you're debating the passengers and frankly, they always seem to win, right? And I mean, mostly because I think they're offering way better things than I am, right? They're offering cake and lying on the couch and I'm offering broccoli and going to the gym, right? So like, yeah, they got better options like than what I'm offering. And, you know, the other part is that when we're busy debating the passengers, we're kind of also not paying attention to where we're going, right? We're like looking backwards trying to get all the passengers in line with us. Okay, so sometimes, you know, debating them doesn't actually work either. Okay, so now I'd like you to imagine you're a bus driver driving around HRM, and a passenger gets on your bus and he says, hey, bus driver, could you drop me off at my house? It's just like your third left and your second right, and it's like the house with the red door. If you were a real HRM bus driver, what would you do or say to this passenger? right? You probably have some version of, no, sorry, I can't. I have a route to follow. Right now, you'd probably know to acknowledge the passenger because otherwise he'd start screaming and yelling at you. But you'd kind of be like, sorry, buddy, I can't. I have a route to follow. And that's sort of the relationship we're trying to have with our passengers on our bus, with our thoughts and feelings and sensations, is that we can acknowledge what they say, but we don't let them divert us from our route quite as much, right? And so if that was the goal, then there's like two main skills. One is to know what route you're going on, right? And the other one is to be able to deal with the passengers in a way that they're less likely to take over the bus. Okay, so let's do a little activity here to talk about what does your route look like. Okay, so values are a concept in psychology that's about, what really matters to you in life, the kind of person you want to be, how you want to show up in the world. And values are helpful because they help give us direction, which is that our culture is very obsessed with goals, right? And goals are things that happen or don't happen. Values are more like the direction that you're headed as you're pursuing goals. So, for example, if heading west, for example, was important to me, there's a couple things about heading west. First, I might hit some markers along the way that told me I was heading west, right? So I might hit some goals that are telling me I'm heading west. But also, every step I take counts as moving west. It's not just when I get to the goal that it counts, but every step there counts. I also never get to stop, right? Because if I'm trying to head west, I kind of always have to be heading west. I never get there. So, for example, values are things like being creative or authentic or being an engaged parent or being a creative employee. So those are the kinds of, qualities of like how we want to show up in life. So, for example, if it's important to me to be like a kind and loving person, then it's not just major markers like maybe getting married, right? But also like everyday things that I do to express that value, coming home and kissing my kid hello, right? I also don't get to stop. So I can't be like, in 1989, I was super nice to my sister, so I'm good. Right? If being, a kind and loving person is important to me, then I have to keep expressing that on a regular basis. And so values are more like that direction that you're headed. So you might have a goal, for example, like getting a university degree. Okay, that's a thing, it's a goal, it's gonna happen or not happen. But there might be a value that underlies that, and that might be things like intellectual curiosity or personal growth. And if for some reason you can't get the university degree, there might be other ways that you can still express those values of intellectual curiosity or personal growth. So often something that happens for people when they have a chronic condition is that it limits things that they wanted to do. They can't do all the things that they used to do. So for example, parents might say things like, well, I can't run around with my kids the way I used to because I'm in too much pain, right? And so looking at what that value is about what's important to you about being able to run around with your kids, is that about being an engaged parent, or is that about modeling physical fitness, right? To figure out what that value is, and then to figure out other ways that you could be an engaged parent. So maybe that involves like reading a bedtime story or helping out with homework or other ways of trying to express that same value. So chronic condition can sometimes feel like it's taking away things that we used to do or we used to be. But we can think about what are the values around why is that important to me? Why does it matter to me to do that? And that value, you might be able to express that in a different way through different behaviors. And again, we have the most control over our behaviors, right? So showing up and doing things that are consistent with that behavior or that value. Okay, so let's just do this little experiment to see how our passengers knock us off our route. Okay, so for example, in your mind, set yourself a self-care goal. So maybe one of the things that you heard today about, reduce sugar or, taking your medication regularly or pacing. So one of the things that you heard today that you're supposed to start doing, right? And just think about that you're gonna do this goal, or you're going to be responsible for doing this goal. And just pause for a second and notice what kinds of thoughts and what kinds of feelings immediately show up when you think about having to do that goal. So if you have to reduce sugar, or start eating more garlic, or exercising every day, right? If you just stop and think, what immediate thoughts kind of show up in your head? Just notice that for a second. Okay, so do any of your thoughts fall into these categories? Obstacles. It's going to take too much time. Judgments. I'll never be able to do it. Comparisons. Well, everyone else can do it, but I never get to do it. Or predictions. I'm not going to stick to it, so why bother? Did any of your thoughts fall into those categories? Did most of your thoughts fall into those categories? Congratulations, you are well-functioning humans. Okay, why is this, right? So here you are trying to do something healthy, right? Something like a dietitian or a physician or a physio or a psychologist told you should do. So what's going on? Why are passengers being so difficult, right? These are like your passengers chattering at you. Okay, so one thing to remember is that part of our brain is part of an ancient caveman brain, right? It was developed in caveman times and completely well-suited for the things that cave people were facing, right? So this little quote says, something's just not right. Our air is clean, our water is pure, we get plenty of exercise, everything we eat is organic and free-range, and yet no one lives past 30. Right, which is in caveman times, that was our life expectancy, about 30, right? So frankly, you weren't worrying about arthritis because you were already dead, okay? So if we think about this caveman mind, it's still part of us, right? It still influences us, and it's the stuff that kind of shows up automatically. And so if we think about these immediate thoughts that showed up when you thought about doing this goal, most of them are to try to stop us, kind of inhibit us. And actually, as a caveman, that was really good advice, right? So cave people who didn't have any inhibition, who just like jumped into new things and tried new things out all the time, probably died, right? Because the world was really dangerous, right? So if a caveman's like, hey, let's go explore the jungle, and he just like runs out into the jungle, not our ancestor, right? So the way our caveman brain works is that the devil you do know is better than the devil you don't know. So however crappy your life might be now, you're alive, and that's all that matters to a caveman brain, right? Caveman brain is focused on survival, not quality of life, right? So I don't care if you don't have any quality of life, you're alive, and so my job here is done. Right? If you go somewhere else, I don't know if you're going to be safe. I don't know if I can help you out there because I don't know what that is. I know that here is safe. So come on, let's just stay here, right? Which is how our mind comes up with trying to stop us from doing new things, right? Because the devil you do know is way better than the devil you don't know, which is why behavior change is so hard. Because any new thing that you're trying to do is actually activating your caveman mind and being like, oh no, dangerous, don't do that, right? Which is why it comes up with all of these great suggestions, right? Oh, it's never gonna work. Why bother? It's too hard, right? You're gonna buy like a week's worth of garlic and never cook it, and then it's gonna like just stink up your kitchen, so just don't bother, But the good news is that the fact that your mind does that means you're a well-functioning human. And the advice, if you were a caveman, would be super awesome, right? Very helpful. The problem is that in our modern world, here you are trying to actually do some new healthy habit, and so this advice from your mind is actually kind of bad advice, right? It's super awesome advice if your whole purpose is only survival, but most of us actually have the luxury of worrying about our quality of life. We actually care, right, about how the quality of our life and not just whether we're existing or not. And so this caveman advice tends to be kind of bad advice. Right? Now, the thing being that almost any healthy habit that you're trying to do, I guarantee any thing that somebody recommended for you to do today is going to go against your caveman mind. Okay, caveman minds are designed to avoid pain because pain usually resulted in death, to seek pleasure because there was not a lot of food or resources around, and so you're trying to go get those resources as much as possible, to take the path of least resistance. So cave people were getting the same amount of exercise in their day-to-day lives that triathletes get nowadays. So just to survive, you were getting the exercise of triathlete. Okay, so if you had the option to rest, you were resting, right? So, as a caveman, you didn't have to be the fastest guy, you just had to be faster than the other guy, right? And so if you were running around, going out for a jog for no good reason, and then, a tiger starts chasing you and you just ran around for no good reason, you are not our ancestor. Hey, the ancestor who rested every time they got a chance, took the path of least resistance, that's our ancestor, because he had enough energy to outrun the other guy, right? And it's also about living for today, right? If you have the life expectancy of 30, you are not worried about what happens to you in your 70s or your 80s. You're worried about right now. Right now is the key thing. Almost any health behavior someone's going to give you violates those principles. Okay, so don't reduce your sugar. Okay, violating the principle of seeking pleasure. Your brain goes off like the same way it does for cocaine when you have sugar. Okay, so we are hardwired to love sugar and to seek it out in all chances possible. Now, is sugar healthy for you? No, it's clearly not. But your caveman brain really wants it still. Right? So reducing your sugar is going to violate a caveman principle. Right? Exercising, any form of exercise is going to violate the principle of path of least resistance, right? Things like taking medication often don't do anything for you right now, but they're going to help you 10 years from now avoid something bad. So that's totally violating the principle of live for today. Right, so pretty much any healthy habit that you're going to do is going to violate one of those caveman principles. And your caveman mind, being the awesome, well-functioning mind that it is going to give you some advice not to do that, right, in the form of your passengers' thoughts and feelings and sensations to try and stop you from actually doing this healthy habit. Okay, now we can't change your caveman mind. I don't know how to make you a non-human, right? So our job becomes noticing, right, when our caveman mind's giving us some bad advice, and to ask ourselves whether this is going to help us move towards our values or away, right? So if you have the value of being an engaged parent, then reducing your sugar and being healthier is actually going to help you be an engaged parent. Right? If you are exercising more, you're going to be able to be more active with your kids. So often these healthy habits are directly linked to our values and directly linked to the people we want to be and our quality of life and the kind of person we want to be, right? But our caveman minds are going to tell us not to. They're going to give us all kinds of advice not to. And our job is just to notice our minds doing that to us and to not fall for it. Right? It's like if you get those like spam emails, and they're like, you've won $1 million, just click here and like give me your bank account information and then we'll send you $1 million, right? Or like something really bad is happening, you better like click on this link to prevent the bad thing from happening. Right? You can't really stop the emails from coming in, but you can stop yourself from clicking on the link. Right? You can't stop your mind from giving you its caveman advice, but you can stop yourself from falling for it. Okay, and what that looks like, one version of that is to simply thank your passengers, right? When they give you their caveman advice, to remember that they're actually doing that with your best interests at heart. They really think you're about to do something dangerous or life-threatening, and they're working really hard actually to try and take care of you, to keep you safe, right? It's just that they're working with an old playbook. It's not the same thing as when you're in caveman days. And so with some gratitude for how hard they're working to try and keep you safe, we can just thank the passengers, right? So when I'm like, get home from the work and I'm like, I should go to the gym, and my passenger says, I don't have time for that. And I'm like, thanks, but no thanks, right? I hear you, I know, but we're gonna do it anyway, right? So the bus driver actually doesn't have to have consensus of all the passengers on the bus to drive the bus, right? The bus driver's not like, okay, everybody, I'm gonna go down Barrington Street, and then I'm gonna take a left on Spring Garden. Everyone okay with that? No, he just drives the bus, right? So you don't actually have to have your passengers agree with you in order to do the thing you're trying to do. Okay. Okay, so just one last little activity about reminding ourselves about how to manage the passengers is what I'd invite you to do is to do the following exercise with me, and please do, otherwise I look kind of silly doing it by myself, which is that to say over and over again, I cannot lift up my arm, and at the same time to lift up your arm. Right? So I cannot lift up my arm, 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 I cannot lift up my arm. Okay, let me put your arm down. Okay, so it's possible to do the opposite of what your mind is telling you. Right? So we weren't like cheerleading, we weren't like, you got this, you can totally get your arm up, you're good. Right? We're like, I cannot lift up my arm. I cannot lift up my arm, right? We don't have to have all the passengers agree with us. You also don't have to enjoy the thing you're about to do, right? The behavior is what counts, not your feelings or your motivation. So it's a very common advice for people to say, find an exercise you enjoy. I'm going to say it's totally okay to hate every minute of it, as long as you do it. Right? This is about doing a difficult thing in the service of your values. So, for example, if you've ever been a parent or grandparent, I guarantee you have done crappy things in the service of being a parent, right? You've like stayed up with sick kids, you cleaned up vomit, right? You do all kinds of crappy things when you're a parent. Going for a walk or taking your medication or eating more broccoli might just be one more difficult thing that you do in the service of being the kind of parent you want to be or being the kind of grandparent you want to be. So rather than waiting for it to feel good, right, or enjoying it, now people will argue with me, right? They'll say, some people really do enjoy exercise, and I'm like, that's great, but those are not the people you're trying to encourage to exercise because they're already off exercising, right? So if you're someone who's not exercising, it's okay to hate every minute of it. Right? So, I trained for a half marathon. I hated every minute of it. I do not enjoy the act of running, right? But I feel really cool standing here telling you I ran a half marathon, right? So that's somehow part of my values, right? To walk the walk of all the things I'm telling people to do. But the actual act of running, it totally sucks. I don't like it at all. Right? I'm just willing to do it, willing to feel the discomfort of it, willing to go against my passengers in the service of something that matters to me. Right? And you're much better off to find something that matters to you already rather than trying to make health a more important value. Right? So health actually isn't a value, it's a domain, it's an area, it's a part of life. Right? Being healthy is not a value. Right? So what is it about health that's going to help you? So if you were healthier, what kinds of things would you do more of or less of? How would being healthier help you be the person you want to be? Right? So when we ask people this question, we'll say, well, why do you want to be healthier? And people will say things like, so I can live longer, so I can, avoid some bad health outcomes, so, And the next question that we often don't ask is, and what are you going to do with those extra years of life? What are you going to do with the extra energy? What are you going to do with the extra time on earth? Because if you just want to sit around and watch television, then don't do any of these things people told you to do. Go ahead and eat all the sugar you want. Because if you aren't going to do something meaningful and important to you in those extra years with that extra energy, all of this stuff just sucks, right? All the healthy habits people are going to tell you to do mostly just suck because they violate your caveman brain. Okay. So if you'd like some additional resources, these are some books that might help you. I'm very happy to say that I am actually have a book coming out in May called Healthy Habits Suck. How to get off the couch and live a healthy life even if you don't want to. So, and that's coming out soon. So, maybe I can go back. Hey, in addition, so my group at the hospital, we run a research and training group. And so we do all kinds of workshops for both healthcare providers and patients in terms of coping with chronic disease, helping healthcare providers interact with their patients in a better way to help support chronic disease management, and things about professional resiliency for healthcare workers. So if you'd like more information about me, that's my website and my contact information. And so I'll just say thank you to you and all your passengers for being here.